Welcome to the American Hospital Association special podcast series, Just Lead, a look at how hospitals and health systems that have been recognized with AHA awards for innovation, collaboration, and health equity are transforming healthcare to better serve their communities. The results have been encouraging. Thanks for joining us. I'm Tom Hederle with AHA Communications. Carolyn Boone Lewis was a tireless advocate for equity in healthcare. She was also the first African American and first hospital trustee to serve as board chair of the American Hospital Association. The AHA acknowledges her lasting contributions with the Carolyn Boone Lewis Equity of Care Award, presented annually to recognize the outstanding efforts among hospitals and healthcare systems to advance equity of care to all patients and spread lessons learned and progress towards diversity, inclusion, and health equity. Today we are joined by an honoree of AHA's 2022 Carolyn Boone Lewis Equity of Care Award, Jefferson Health in Philadelphia. Here to share their story with us is Dr. Sandra Brooks, the Executive Vice President, Chief Community Health Officer, and Chief Medical Officer for the Center City Division at Jefferson Health.
Hello, everyone. This is Dr. Leon Caldwell, Senior Director for Health Equity Strategies and Innovation at the Institute for Diversity and Health Equity, the American Hospital Association. I have the pleasure and honor to welcome to this podcast Dr. Sandra Brooks, who's the Chief Medical Officer of the Center City Division and Executive Vice President and Chief Community Health Equity Officer at Jefferson Health. Hello, how are you, Dr. Brooks?
I'm great. Good morning.
You have the distinction this year of being one of the honorees for the Equity of Care Awards, and that's the Carolyn Boone Award for Equity. It's one of our flagship awards for the association, for AHA. So it takes a lot to get this award. It's not just something we do lightly. There's a whole process we go through. And one of the things we like to highlight is like this innovative, creative work that really does connect into communities. Tell me more about that work that you've been leading at Jefferson Health.
Well, thank you. The Philadelphia Collaborative for Health Equity was established in 2017 on the premise that we recognize that there are deep disparities within our community surrounding Philadelphia that have existed for decades, but that the communities, though they're distressed and under stress, have assets. And it was the goal to work deeply with those communities to amplify their voice and to help to build capacity. In the wake of the pandemic and the undeniable fact that many of those disparities deepened in a very short period of time, I was asked by our CEO at the time to take on the leadership role of the collaborative, which is now renamed the Jefferson Collaborative for Health Equity. And really what the aim to do is to really take an asset-based approach, which recognizes that while there's a 20-year life expectancy difference between Society Hill, which is one of our more affluent communities, and North Philadelphia, again, there are assets in those communities. So we're aiming to build capacity, doing that through a number of different ways, working with, through developing catalyst grants where we work with community-based organizations to help them develop evaluation plans and help to guide them and mentor them by providing them seed funding to address different aspects of the built environment or green spaces or mental health resiliency, for example. We also have a community health worker program that we're aiming to develop into an academy. And we also invest in health equity related implementation science and those that are underrepresented in healthcare. We also have infrastructure that we aim to help to support through generous donations. We've been able to establish a stroke prevention center as well as a clinic that's in a very diverse neighborhood. And we also work with multiple stakeholders to address some of the larger drivers of health equity. For example, food access. So that's just a snapshot of kind of some of the work that we're doing, but we learn every day more about our communities, and that helps us to serve them in a better, more culturally aligned way.
That's awesome. So as a son of West Philadelphia, I'm always impressed with the level of input as well as what I hear is listening that your hospital does, the Jefferson does. Can you tell me, when you're listening, how do you find assets? Like, how do you find assets in the community?
Well, I'll give one example. We had a celebration of our equity scholars this past week, and that program is made possible by a generous donor, anonymous donor, and really I worked very closely with my Office of Institutional Advancement colleagues to craft this program, which is really has twofold. One, in honor of Carl Mansfield, who's a prior department chair of radiation oncology, really a pioneer. So that's really to support faculty who are underrepresented in healthcare. The second is in honor of our first African-American director of nursing in the operating room, and that's to encourage faculty from multiple disciplines to work with community partners. So one of those faculty members for that second award is working with a community-based organization with whom they partner to help address unique issues related to autism. The community partner that they're partnering with has other partners that they partner with. So in connecting the work that they're doing to really develop better mechanisms for individuals who are on the spectrum to be able to respond in emergency situations, which unfortunately we have too many of. We've encouraged them to amplify their partnership, and they're bringing other partners to the table. And so through that, listening to what they're doing, we're going to find another way to partner with them. So that listening and understanding that they have really been working boots on the ground in these communities for years, they have credibility. And we honor that very, very carefully. We recognize that that's a precious gift for them to allow us to work with them.
Yeah, and it sounds like your listening offers the opportunity to learn, right? And as you learn, then you see where those assets are, things that you may not have even thought of as an asset or may have overlooked as an asset, but they really do become part of what a community brings to the partnership.
Absolutely. It can be too easy for an institution of higher learning, an academic medical center, or any entity along those lines to sort of feel like they have the answers, right? And in fact, the pandemic has shown us that we absolutely need to listen. We absolutely need to work with those who've been working in those communities day by day, and we need to help to amplify their voices. So while we bring something to the table, they bring something that we need and have desperately needed for a very long time. You can have a plan on a page, but you can't execute that plan if it bears no semblance to reality or is not accepted by the people who you're trying to serve.
Right. And that seems to be like the basis of a good partnership, right? Like, particularly working in communities. I've done a ton of community work, and it's that you go from listening, one, having a conceptual frame that the community does have assets, and then listening to what they think their assets are, and then agreeing on what you both bring to it. What are some other elements of just a good community partnership that you found in your work?
Trust, of course, and I think that is probably the piece that is most fragile. It cannot be transactional. And I think too often in our rush to show progress, we may make things very transactional. We have to recognize that this work takes time. And trust, as they say, is very difficult to build, very easy to break.
Yeah, this is great. Another piece of your work, as you describe it, it really is, it seems like Jefferson Health has invested in a pipeline, right? So we talk about the community health workers and really thinking about scholarships. Can you talk about the importance of, in these partnerships, seeing the community as the future, if you will, of your workforce, or not only just your client base, but also your colleagues, future colleagues?
That's an excellent perspective that we recognize. And I think, again, the pandemic highlighted this when we were aiming to get the message out of life-saving vaccines and how important they were, and realizing there were disconnects in many different areas. And community health workers were instrumental in helping us to get the word out and to bring factual information to their communities. So the community health worker we're fortunate in Pennsylvania that there is a pathway to certification in Pennsylvania for community health workers. What we're aiming to do is to bring on the formal training, but also the professional development and the networking piece. So we not only want to provide the basic essentials, but we want to make sure that they're prepared in whatever discipline they choose to go in the future, be prepared to be able to function in that environment. As you said, it's also a pathway pipeline to other potential healthcare types of employment. So,
Awesome. So here's my last question, and you've been great. Thank you for your time. What can you describe as any internal work that you all have had to do as a health system, as a division, to prepare to do this work? Like, what policies have had to change? What practices can you think of? Like, we're going to do this different, because allowing the space for this kind of mindset that communities have assets, right? That your partnership is important. Because not all organizations and institutions and hospitals have that view. So as you're coming in as this leader, you have this great ideas on how this works. What was your kind of change management strategy?
Oh, that is the $100 million question. I think, just as you have to listen to the community, you also find need to listen to perhaps concerns or of those that might be internal stakeholders. So partnership both externally and internally. So it might be, in one example, it might be legal, or it might be risk management, or it might be compliance, or it might be human resources. So I think being able to articulate how and mitigate the concerns that people might have, but also keeping in mind the larger picture that unless we are bold, that's one of our mottos, be bold and think differently. Unless we're willing to do that we will be at risk for creating the same scenario or perpetuating the disparities unintentionally. So it does require, I'm fortunate that there are very strong allies who believe in the work and have helped to guide and provide advice, resources, support to help move things forward.
Well, Dr. Brooks, you've been an awesome guest, and I applaud your work and your leadership, and we look forward to hearing more great things about Jefferson Health and the Center City Division. My city, it enjoys the benefits of your thought leadership and your partnership. So have a great conference, and when you get a chance, please check out equity.aha.org, and you'll see the AHA's equity roadmap, and there's a lot of synergy in the work that you're doing, and particularly around collaboration for solutions is one of our levers of transformation. So again, I applaud you, and really congratulations on being an awardee for the Carolyn Boone Equity of Care Awards.
Thank you so much. It's such a great honor. Thank you.